For Peter Squazzato, just 1 hour in the garden leads to 3 hours of pain.
I've been on the waiting list for 3 years for a hip replacement.
The 65-year-old is on a public waiting list. He used to have private health cover, but now can't afford the high premiums.
Fees were looking at around about $700 a month, and we thought, well, that's just ridiculous. We can't afford that.
There are calls to help lower insurance premiums by getting more young people to sign up.
It will free up space on public waiting lists.
The first proposal is to change who gets stung for not having health insurance. At the moment, when a single person starts earning $90,000 a year, they're hit with a special tax. The tax was intended to target people in the top tax bracket, forcing the wealthy to buy insurance.
The Medicare Levy surcharge now applies at a more average wage than it did when it was first introduced.
But now it's often cheaper to pay the levy rather than pay for insurance.
Raising the income threshold is a good idea, but also probably considering putting the fine up for those people that are very high income earners.
Some experts want to look at a key government incentive, a discount all consumers get on their premiums to encourage people into the private system. Over 70s get up to 1/3 off, but it's far less if you're under 65. So while it becomes cheaper for older people to sign on, it doesn't hold much appeal for the young.
A good thing the government could do to help Australians afford private health insurance is to lift that levy back up to 30% where it first started.
Experts want to adjust another age-specific lever, which penalises people who sign up after they turn 30, by adding 2% to their premium for each year for a maximum of 10 years.
It's at that age that young people are really struggling to pay off HECS debts, to save for housing, they're planning for families.
We think that there's a good argument for this lifetime health cover threshold to be raised to 35 or maybe even 40.
The government launched a review of lifetime health cover last year. In a statement, it says it's reforming medical devices pricing, which should also help bring prices down. Sophie Scott, ABC News.